This particular tool that we call the problem tree analysis helps you to dive into a particular problem that you've seen and how to solve it. All right. So, okay. Now let's see how this tool works. So this tool is called problem tree analysis. I'll be referring to this as PTA, right? Now, this is a tool that sees problem as a tree, basically, and each part of the tree represents different part of the problem or different information you can get about the problem. Remember, understanding the problem still falls under your discovery phase in your design thinking or your empathizing phase, right? Now, let's look at this. So this is how the PTA looks like, or the problem tree analysis. This is for health innovation. You can use it for anything, actually. But yeah, and there are a couple of tools you can use. I think for this particular webinar, I'll be discussing 2 of them. You can also look at root cause analysis for some of us. I think we've used that before. But let's look at this. This is quite interesting. So let's assume now you have seen a problem. The problem is that women don't, increase maternal death, maternal mortality, right? That's your problem. What the problem tree analysis says is that first you have the root, which is the root causes of the problem that you have seen. And that is also, as an innovator, you need to be very careful. Sometimes when you see a problem, what you see as the problem may not necessarily be the problem that you want to solve. You know, but the problem we have as innovators is that when we see a problem, we tend to run with the problem and just create a solution, only for you to realize that there are other root causes to what you have solved, basically. So you need to look at root causes. Then the problem itself is your trunk, the trunk, and then you have the branches, which are, of course, the impact of what for example, we're going to see example here. Let's assume let's say we have a problem. Now, this is a problem that is for those that so I work in the how do I put that space now? I will say, yeah, it's not necessarily in Africa, but low resource setting. So Africa, of course, Middle East, and then also I also support some projects around Southeast and Asia, right? And these are low resource. One problem, particularly for sub-Saharan Africa, is the fact is about antenatal, right? And what we've observed, and this particular problem, just as I told you, you can get your problem from different sources. If you look at WHO document on ANC, antenatal care, you realize that you have a lot of women coming for their first visit, and subsequently, let's say 80% come for first visit. Subsequently, you have 40 and let's say 30 coming for second and third. Then the problem is, the issue is what's happening. And this is where I defined this problem. So let's look at this problem. Women are not returning for the second and third antenatal visit at a Sabongeri clinic in Kano. For some of us that have been to Kano, Kano is in Nigeria. So the first question is, so if you have this as a problem that you've seen, probably working in this health system, it may not necessarily be one clinic. You might probably have seen this problem across a number of clinics, right? Then you first want to discover what the problem is. And in discovering the problem, what do we need to do is that we need to empathize, right? In empathizing it, we need to identify stakeholders. If I may ask, who in defining this problem, who do you think should be part of the stakeholders that we should discuss with? You can drop that in the chat. Let me just, let's do some brain work a little. Yeah, you have a problem. We are in the discovery phase, right, of design thinking. Now you have identified the problem. Now you want to discover it, but you need to identify stakeholders that you need to discuss with to know how to, this problem in detail. Who are the stakeholders that you'll be discussing with? Can anybody you can just put that in the chat if you have an idea. The women, perfect, thank you. Thank you. The women, of course, the women, they are the one that are using these services. Any other stakeholders that you want to discuss with? Okay, let me tell you, as people are thinking, let me tell you a joke, right? It's not necessarily a joke, it's actually a real life story. So I was with a team, we're developing a project. Doctors, yes, of course, doctors, the nurses, the midwives. And we developed, because I work with a medical organization, and we developed this project with the assumption that it's what the people need. They need to be treated for malaria. They needed to be treated for pneumonia because we are medical. But when we got there and we tried to do community engagement, guess what? The people said, yeah, we know you should be treated for malaria. We should be treated for pneumonia, for diarrhea. But what we need now is food. You know, they need food, you know. So what I'm saying is that sometimes you define your solution based on some assumptions if you don't engage. Thank you, researchers. Of course, researchers, you need to, some people have worked around this particular area. You want to discuss also with them. Yeah, so these are different stakeholders, but most importantly, discuss with the women, discuss with those that are using it. Now, if you have discussed with them, you'll be able to identify the root causes, right? You'll also be able to identify the impact of this not coming to for second and third antenatal visit. Now, let's see, because we don't have time, I will have asked us to give some root causes and some effect, but maybe we'll see that later. Now, look at what we did here. If you look at this place, you will now see, sorry. Now, this is an analysis of this particular problem, right? So you will see women not returning for second and third antenatal. What are the causes? Some of them will tell you long distance to the clinic, health workers, poor attitude, you know, maybe the doctors are not nice. There are cultural myths about pregnancy. I think we was talking about uptake in clinical trial. There are cultural myths also. Maybe you might probably want to also look at something like this if a digital tool, a digital solution will help, you know. Then also no understanding of impact of return visit. They don't even have understanding. Why should I come for the second one? I've been there for first one. They gave me maybe net and other stuff. Why should I come? But again, what is the impact of this? What is the effect? Then we go to the branches, right? One of them is that, first is that there is lower trust in the health system. You know, there's lower trust in the health system. Of course, higher maternal and infant death is a big one. And there will be late detection of complications and frustrated health workers. Frustrated health workers, if the mothers are not coming back, they'll be frustrated because they are not achieving the goals. But again, what I want to say as an innovator is that if you've come up with this as your problem and you jump into it and say, okay, yeah, they are not coming back home, like I would do probably because I work with this kind of system. Maybe I would do mobile clinic, right? And maybe by the time I didn't discuss with these women, I didn't discuss with their family, and I did mobile clinic, and I realized that, oh, these women actually, they are maybe I decided to do mobile clinic on Wednesday, and I realized that on Wednesday they go to farm. You see, so again, when you see a problem, right, you must be able to dig into the problem to be able to identify the root causes. The last thing I would say about this problem tree analysis is that at the end of the day, when you identify your problem, you realize that you don't necessarily need to solve the problem that you have in mind. You might end up solving what we call a niche problem. And this is what I want us also to go home with. You might end up solving a niche problem. For instance, I'll still go back to the example we got about the digital education tool that one of us is working on. Now, maybe I see that, okay, maybe I've identified 1, 2, 3, 4 courses. Okay, I'm going to work on digital tool or maybe ed promotion to actually educate them about pregnancy and the reason why they should come back, you know? So I've chosen some niche problems instead of this big one, right? Then somebody else can say, oh, long distance to clinic. Maybe that is not within your capacity. And of course, you are just an innovator. Maybe the government, of course, want to look into that. Health worker, poor attitude, of course, maybe not within. But again, what I'm saying is that by the time you do your root cause, you know, analysis as it were now, you'll be able to also have a niche problem. Now, let's see